My name is Shrag Patel. I am a attending nephrologist here at Lutheran General. I've been on staff at Lutheran for the last 20 years. I started my residency here, went to fellowship locally at Loyola, and then returned here to take an attending position with some of my mentors in nephrology, and I still work with them to this day.
Like I say, I started here in '81 and did residency to '84 and did chief residency till '85, and then stayed on as internal medicine faculty in the Ambulatory Care Center.
Parag Patel from Cardiology here today to talk about Lutheran General and its impact on myself and my ability to be trained here and interact with the house staff. I've been part of the medical staff here for 22 years. I did my internship here, residency, cardiology fellowship, and then had a chance to teach in the cardiology fellowship program and have been a faculty member of the internal medicine residency program.
Hi everyone, my name is Alma Arslanagic. I'm one of the attending physicians, a hospitalist at Lutheran General. I've been with this hospital since 2009. I did my residency here, and then I never really left because I really enjoyed working in this hospital. I enjoyed the culture and the people, and create some long-term relationships.
My name is Asif Lakha. I'm one of the interventional gastroenterology attendings here at Lutheran General. I did my medicine residency here itself at Lutheran, starting in 2007, and then stayed on as a gastroenterology fellow. Finished my training in 2013, and then went on to do an additional year of interventional GI training and came back to join the medicine program here at Lutheran. I've been here for a total now of 13 years.
So I've been at Lutheran for close to 30 years. It's an institution that combines academic excellence with a feel towards your fellow community members. So we have people traveling from the 3-state region to see some of our expert clinicians. We have a strong teaching program, and those are the elements that have kept me very happy and motivated for a long time.
The reason I came back as an infectious disease physician is that, we can see anything from, atypical pathogens and HIV to, a lot of the, wonderful bread and butter medicine. So that was, the main reason I came back, definitely. And just the relationships I had fostered during residency, to work with those people again was, quite exciting, and I'm happy for that.
Hi, I'm Anand Ramadrai. I'm one of the attending nephrologists here at Lutheran General Hospital. I was actually born and raised in the western suburbs. I did my medical school training in Kansas City, Missouri, and I actually did my residency here at Lutheran. I graduated in 2018.
Wonderful. I came away with a great sense of what to expect, on my boards and in future practice, which was reassuring, and also a wonderful, group of friendships and colleagues. Developed great relationships with my residency class and my attendings, and that's something that I carried with me beyond training.
I would describe it as a fantastic general medicine training opportunity. I would say it is the right mix of independence and supervision. I was allowed to make a lot of decisions during my training. The program goes out of its way to accommodate residents who are interested in subspecialty training, and I was able to arrange rotations in gastroenterology that helped me set up for the fellowship of my choice. Similarly, I recall during my internal medicine training, other residents who were interested in other subspecialties were also able to go train even for outside rotations, so they could strengthen their chances of getting a fellowship of their choice?
It was a really great residency. I just felt always supported. I felt that our associate program directors and at the time program director was really excellent and always wanted to make sure that we also focus on our well-being and making sure that we still do a good job while taking care of each other.
Interestingly, my residency at Lutheran may be unlike others that I had never done a rotation or a single day here at Lutheran as a student. It was something about the facility, the name, multiple things, and some of my mentors at other hospitals who had been residents here had highly recommended it, and I've had no regrets since then.
So I had a great residency experience here. I think one of the things that really attracted me to Lutheran was the people here. I actually did a couple rotations as a fourth-year medical student here, and I just fell in love with the place. All of the attendings are just really great to be around. They love to teach here. And then the one thing that you'll realize is that a lot of people who've trained here love to come back as attendings, which really speaks volumes to what kind of program that they have.
Well, I graduated from the residency back in '84 and had no plans to stay here. But after experiencing what Lutheran General's like, I decided to stay on as faculty in internal medicine. It's a great place to learn. You spend your time learning clinical care of patients, and the overall environment is just a very pleasant place to work.
A chance to give back to the program that helped train me, not only in medicine but also in gastroenterology. The fact that we have residents and fellows here who I love to teach.
So as I reflect back over 25 plus years in the institution, it has favorably impacted my ability to assist patients and my ability to grow professionally. And the interaction with the house staff has been a vital part of that over the last quarter of a century. So I encourage you to think strongly about Lutheran General as a place to train, but more importantly, think about it as a place that you might have a future in healthcare.
So one of the biggest reasons I returned to Lutheran is, as I mentioned before, my mentors were here. They offered me a position to come back. But as you go through many of these testimonials, you'll see a lot of the physicians who trained here returned here because of the environment, quite honestly. It's an excellent program. You have the opportunity to teach not only students, but residents. You have multiple specialties within this hospital, so although this is not a university setting, it's got a feel that's very close to a university setting, but still with that community charm. And I think that's the reason that a lot of physicians return here, because they enjoy their camaraderie with their other physicians, the students, residents, the nursing staff, and the patient population that you get exposed to is excellent.
So I actually joined the group that actually mentored me as an intern. It was funny because I did a nephrology rotation halfway through my first year of residency here, and I fell in love with it. They were wonderful teachers. They took me under their wing, and after I left for fellowship, I kept in close contact with them, and they offered me a job.
It's just a friendly environment where everybody seems committed to taking care of the patients. I also say our clinical care of the patients is number one, and resident education is 1A, and they're both great.
This place has always had a collaborative environment that allows trainees to freely approach the attending staff and to work with a high-quality nursing and ancillary service staff.
I mean, if you walk in the hallways here, most people know the residents, and they can say, hey, hello, Dr. such and such, and a lot of the physicians know the residents and call them by their first name. And so that's kind of a nice, kind of a family-friendly environment that I don't think has changed in at least the 20 years that I've been here. You may see different buildings, you may see different faces, but I think that portion of this program has stayed the same.
Working with residents keeps you on your toes. Every time you get new students, new residents, and teaching rounds, they're always asking questions, and they seem to get smarter as time goes on.
So combination of things. It's nice to work with somebody. We do a lot of things on our own. To be able to share that with somebody who's interested and energetic, to be able to make the light bulb go off for them and see that they've learned something that you've acquired previously is very fulfilling. I also feel energized. I feel impressed by how much our residents know, things that I thought were difficult to understand, concepts that I've learned only within the past 10 or 15 years. They just seem to already have that knowledge base, so I'm very impressed by that.
Working with residents, which I really enjoy. I like to teach them. I like to really be like their mentor, where we're not just talking about medical cases and medical treatments, but also their lives and their aspirations and what they're planning on doing later in life. Even some on personal level, I know a few students and residents just because we have that kind of relationship.
I would say that my relationship with residents and trainees in general is very collegial and friendly. A lot of them go on to become faculty and staff here itself at Lutheran General, either directly or after they complete additional training. And so I know a lot of my previous trainees who are now actually co-workers. And so I would say that the relationships that we go on to develop when they are trainees play a big role in the future, as they might very well be co-workers a few years down the line.
Cubs.
Cubs.
Cubs. North side.
Cubs.
Twins.
I'm not really a sports fan. I don't follow